Great. Well, hi, everyone. Are we live? Okay, we're live, and I see the number of attendees here increasing. I think that that was people who were trying to log on before we got started. So I'll just wait a couple minutes for everyone to get settled and get their headphones on, and then we'll go ahead and get started. Great. Wonderful. So for everyone who's joining, we'll just get started in a few moments. We're just waiting for everyone to settle in. Great. And all right, so we will go ahead and get started. So thank you so much, everyone, for joining us. You're at the networking session 1, Movements and Their Allies, How Donors Can Support Grassroots Change in Health. And so this is part of the Women in Global Health Security inaugural summit, which is being co-hosted with Women in Global Health, for which I'm the deputy director. And we are working with the Wagner Foundation. We actually have Charlotte Wagner here on this panel, as well as Foreign Policy and the UN Foundation. And I hope those of you tuning in were able to attend some of the earlier sessions, as well as the main plenary. And we're really looking forward to a fruitful discussion today, especially talking about, how women's movements can drive gender equality in health in particular. So a growing body of evidence proves that women's movements are actually driving gender equality, yet only 1% of gender-focused aid actually went to women's organizations, and the bulk of this went to international organizations based in donor countries, rather than feminist groups leading their own context-specific solutions. So in the context of COVID-19, where we've actually seen women's leadership in their countries and on the front lines, questions are being asked about donors' funding for women's movements to drive transformational change in delivering gender-responsive health systems. So in this session, we're going to explore what to expect from the funding landscape during COVID-19 and post, and how we can work towards more donor funding for women's movements now and in the future. So I'd like to introduce you to our esteemed panel. So first, we actually have Charlotte Wagner. She's the CEO and founder of the Wagner Foundation. And it is a Boston-based foundation whose mission is to build just and robust communities throughout the world. She believes that health systems strengthening, including medical training, in accompaniment with local organizations is critical, as well as long-term investments. And so we're excited to hear from Charlotte today about her take on women's movements and health systems. We also have John Green. He's a best-selling author and co-founder of the Green Brothers. You may know him from his famous Crash Course. So he's actually also the author of a really popular book that was then made into a Hollywood movie called The Fault in Our Stars. So welcome, John. We also have Tikhala Itaye, and she's the chairperson of SheDecides, a global movement, and also the executive director of Her Liberty Malawi. So welcome, Tikhala. Tikhala is a lawyer by profession, and she's passionate about social justice. She leads her own youth-led NGO in Malawi called Her Liberty, and is the former president of AfriYan, the African Youth and Adolescent Network. So thanks so much for joining us. We also have Leila Hessini, and she is the Vice President of Programs at the Global Fund for Women. Leila oversees their strategic grant making, movement strengthening, voice and advocacy efforts. She's a global feminist leader and social justice advocate with over 20 years of organizing and grant making experience, both here in the US and globally. So welcome, Leila, and thanks so much for being with us. And I just want to see if we have Her Excellency, Mrs. Saraki here. There you are. I'm so glad you're able to join us. Hi. So I'll just introduce Her Excellency. So Mrs. Toyin Saraki is the founder and president of Wellbeing Africa Foundation, Wellbeing Foundation Africa. And she's a Nigerian philanthropist with 2 decades of advocacy covering maternal, newborn, and child health, gender-based discrimination and violence, improving education, socioeconomic empowerment, and community livelihoods in Africa. She also launched a successful social media campaign through Wellbeing Foundation Africa in 2012 called Maternal Monday to raise awareness on key issues in maternal, newborn, and child health in Africa. So welcome all of you. It's so great to have you here with me today. And so I'll actually just get started with the individual questions, and so we can get to know you a little bit and and allow the audience to do the same. And so Charlotte, I'll actually start with you. And so Charlotte, you are a philanthropist, but you're actually also a marketer in training, so in your background. And so I'm really curious to hear a little bit about, why, can you just tell us about why you are interested in supporting women's movements in health? And just given your experience investing in health systems, why do you think it's important to support women's movements and advocacy?
Sure. Thank you. Thank you, Sarah, so much. And I'm thrilled to be a part of this esteemed group of folks contributing to this conversation. I think for me, it may be, I'd like to just talk a little bit about how I got to this place of realizing that supporting women's advocacy groups like Women in Global Health is a really important thing to do. And as you mentioned, we have been very focused in health system strengthening and have been working, I would say, for the last 10 years with partners in health and other NGOs doing that work. And from doing that work, what you realize is that the majority of the patients are women, and the majority of the caretakers and the women that are providing care on the front lines, community health workers and nurses, et cetera, are also women. And so, if 70% of the health workers are women, then certainly you really have to focus on women and gender equity to get to global health equity. So I would say that that's kind of the fundamental approach of where we got to this work. And I think organizations like Women in Global Health, they have such a powerful, you guys have a powerful approach to advocacy using research and mobilizing chapters and lifting up the voices of frontline health workers. So I always believe that putting the power in the hands of the people who are on the front lines, who are doing the work, is the most important first step that we need to take, especially as philanthropists. We need to locate those voices and center our work in that area. And so I think, in addition to that, your commitment to research, I think that, we really feel like that combination of working both from the health system strengthening side of things and incorporating advocacy and movement building is really is a way to get much further and deeper into achieving global health equity.
Wonderful. Thank you so much, Charlotte. That's great. And we're really grateful to have someone like you who not only understands the health systems piece of it, but also understands why we need the advocacy as well to help drive the programs and help drive that other side. So thank you so much for that. So now I'll turn to Her Excellency Toyin Saraki. So it's really great to have you here. So one of your initiatives, so not your foundation specifically, but your new initiative, the Wellbeing for Women Africa initiative that you just recently launched, I think it was in the last couple of years, amplifies the voices of young women into decision making. So can you tell us a little bit about why it's important to you to ensure young women have a seat at the table, and how can donors support this?
Thank you very much, Sarah. I'm delighted to join you all here today and to be part of Women in Global Health. When I endowed Wellbeing for Women in 2016, I did so because I really wanted to support young advocates. They begin to give life to new solutions that they have crafted themselves. The WBW Voices program actually elevates the voices of African youth by paying a global network of youth partners microgrants to write about their perspectives on some of the most pressing social issues of our time. So far, we've got 63 youth partners across 18 countries, and it expands every day. Through the WBW Voices, I'm able to have the huge honor, actually, of mentoring young leaders who are interested in sustainable international development and to support them as they develop their ideas and strengthen their voices. I think it's vital that young people have a seat at the table, and that seat is not given as part of patronage, but as part of their right. It belongs to them because it promotes their development and well-being. It improves the understanding of human rights by young people, and it increases the commitment of the youth to uphold and promote human rights for their generation and the generations behind them. I also feel that it gives a chance for young people to voice their needs and concerns, and for these to actually be incorporated in public policy. Ultimately, the participation of youth in decision-making will enhance democracy, will protect the rights of the youth, and will actually lead to achieving the SDGs, because through them we can be sure that no one is left behind. It's particularly important to ensure that young women have a seat at that table, because this is critical for the realization of SDG 5. A seat at the decision-making table actually gives young women control over their future and their present lives. I recently wrote about Nigeria, saying that we had to be clear that we were failing our women and girls because the lived experience of the most vulnerable members of our population was so dire that we felt we had to actually start a new challenge to bring them back. I want to challenge this marginalization and systemic inclusion of young women in decision-making spaces. According to the Wellbeing for Women Africa study under the Wellbeing campaign, they demonstrated evidence that regardless of the sector, women continue to face the same levels of discrimination, and they're unable to make progress due to gender barriers. From my perspective, and this is what I try to lead by doing and endowing Wellbeing for Women Africa, donors can support the progress of young women by committing to engage, accelerate, align, and also to account for women and youth participation, and these are the ways to measurable action. It's particularly critical at this time because we're trying to fill in the gaps and add value to the existing global, regional, and national coordination mechanisms in the response to the COVID pandemic. So I think definitely the voice and the actions in the hand of young people is essential.
Great. Thank you so much, Mrs. Saraki. We really appreciate that. And I think it really speaks especially to what we're trying to achieve at this summit, which is, better health and, more equitable health, but not only more equitable health overall, but more equitable societies as well, through including those at the table who are often missing. So thank you very much. So next, I'd like to bring in John. So John Green, you're with us, and you have a little bit of a different approach to this. You're a vlogger, and you're also an author, a best-selling author at that, and you've used your influence to raise awareness and also millions for organizations like Partners in Health. Can you tell us, what inspired you to use your platform in this way?
We tried to begin from a place of listening, instead of from a place of thinking about what we felt were the most important problems or what we felt were the most compelling solutions. My brother and I are, we know how to make YouTube videos. We don't necessarily know how to change the world. And so, we began and still focus our philanthropy from a place of listening and not trying to come in with preconceived solutions. We felt like there was a huge empathy gap in public discourse in the kind of English language social media services that predominate public discourse in the United States. Because so many stories weren't being heard, as we just heard, so many people didn't have a seat at that table. And that led to, or we felt like that led to a lot of distortions in thinking about how we value human lives, and especially how we value the lives of people from marginalized backgrounds, marginalized communities. And so that's where we began. through visiting Sierra Leone and other places in impoverished communities, other impoverished communities, we just began to feel like we needed to do much more, both as individuals, but also with the platform that we've been given. So we've tried to focus much more in the last 6 or 7 years on fundraising, but also in trying to amplify the voices of people who are doing that really important work. And so that's been the focus for us.
That's really great, John. And can you confirm that so you are working with Partners in Health, but you've committed to 6.5 million? Is that correct?
Yeah, and hopefully much more. Hopefully
That's
more. But that's the kind of minimum commitment to help strengthen the healthcare system in Sierra Leone's Kono district, with an emphasis on maternal health care. As I think you said about Charlotte, like we share that belief that long-term problems, systemic problems, require long-term systemic solutions, and so we've really made an open-ended commitment to that maternal center of excellence and to the big team of community health workers and traditional birth attendants and midwives, and that place will support.
Wonderful, great, thank you so much. And Tikhala, I really want to come to you because I think you bring a unique perspective as the chairperson of SheDecides, which is a global movement for women's bodily autonomy. And so I'd really like to ask you, I mean, what advice would you give to funders who want to invest in women's movements, and what changes need to happen in order for funding to actually reach these movements and have tangible impact on gender equity?
Great, thank you so much. I think firstly is to say, never undermine the power of grassroots movement. I think being in the global space and also working locally and regionally, I have seen for the past 8 years and how grassroots movements have been undermined, and also questioning who is actually leading the agenda. Her Excellency Saraki did mention that the need to really bring young women and young people at decision making at the seat, and it's not just bringing them at the seat of decision making, but actually giving them this capacity and the power to lead the agenda. And I think, a lesson to be learned is for SheDecides movement, for example, and how I have had the opportunity to take up a leadership role, being a young woman from an African country, to lead a global movement at a high level platform. And we have seen just the tremendous support and impact that already has, because reality is we have seen the data around adolescent girls and young women that is just horrific. And there's the need to ensure that the reason why we keep pushing young women to be leading the agenda is because they're closer to the agenda, and then they understand the barriers that many of these young girls and adolescent girls are experiencing. So it's so important to really ask ourselves and question who is leading the agenda. And then the other key thing is stop cherry picking what to fund and what not to fund. I think what I am seeing in this global complex space is when donors continue to cherry pick, I want to fund this and not this, we also begin to create a lot of harm at a local level, because you're seeing fragmented efforts and movements happening at a local level. And if we continue with that cycle, we're going to have a huge problem, because I've had opportunities of just speaking to different local communities in my countries and different other African countries. And you hear of just one district or one region talking about, oh yeah, there's about 4 organizations or 4 movements working in this area, but dealing on the same issue, but not working together because the funders are different, because the funders are also not working together to kind of have a collective joint voice in this issue. And lastly, one thing I also wanted to say is, donors need to take away this white savior complex, and this neo-colonialism approach that we continuously see happening year after year. And really getting to the place to understand from local movements and women's movement to understand what exactly are their needs, letting them define what needs to be funded and how it should be funded is where we need to start having these conversations. And we've seen that with SheDecides as well, the power of allowing local movements to actually define that.
Wonderful. Thank you so much, Tikhala. That was great. And I think it really also speaks to this transformation that we're undergoing right now in the gender equality space, in the global health space. Some are using the language of decolonizing. Some use other terms, but I think we do really need to take an intersectional lens. And that actually brings me to you, Leila. So you are at the Global Fund for Women, and the Global Fund has a different approach, to funding. And so, maybe you can just tell me a little bit about why the Global Fund for Women prioritizes funding movements and funding, those who may be often overlooked, by those traditional funding structures that we often see.
Yeah, thank you. And thank you for including me. It's great to be on this panel with everyone. So the Global Fund for Women was actually founded because of the statistics you mentioned in your introduction, Sarah, that even though we're saying we need to actually put resources in the hands of communities and trust them to define their agendas and their priorities, that isn't what we're doing. And it is only 1% of all gender-focused aid that are going to women's organizations. So Global Fund for Women supports women, girls, and gender nonconforming led organizations and movements across the globe. And they're working on many issues that define women's health. So that could be safe housing, that could be safe work, that could be comprehensive sex education, that could be economic justice, that could be freedom from violence. They're working on these intersectionally, because as Audre Lorde said, women do not lead single issue struggles or lives. We lead complex lives that are intersectional, that are complicated, and health is a state of complete physical, mental, and social well-being, and not just the absence of disease. And so I think that's important to highlight in this session, because the health systems are part of this broader context that defines, enables, or in many cases undermines women's health. So the groups we work with, we support 750 grantee partners right now across the globe. We gave $10 million in grants last year. And we do that in a way that is based on trust-based philanthropy. So it's giving multi-year support, core funding, and flexible funding so that communities can decide what their priorities and what the needs are. We also tend to support communities that do most experience multiple and intersecting forms of oppression. So around health, often adolescent girls, people with disabilities, LGBTQI, sex worker communities are left out of the conversation, and we're not thinking of what their needs are and how gender responsive and gender just approaches need to be created to ensure that we really are not leaving anyone behind. That's what we're committed to.
Yeah.
And if we're actually doing that as a community, that means ensuring that those who most experience marginalization and injustices are at the table and making the decision about where resources go and how they're resourced. So I think there's a lot, that we can do better around that, and that we all have a role in stepping up. Thank you.
Great, thank you so much. And if I could just, so we started a little bit late, so we're going to try to make up a bit of time. So for this next question, I'll just ask all panelists to keep their answers to about 90 seconds, 2 minutes max. And so my next question is, what is the value of women's movements in creating more gender responsive health systems? So some of you had already started talking about that, but maybe you can give me an example from your work about how a woman's movement has actually influenced, a better health outcome, or even in other sectors, right? I know, when I had my briefing calls with some of you, you mentioned sectors like agriculture, or you may mention other sectors, right? So, how do women's movements really move the needle on gender equality, and how do they deliver better health? So I will actually just go ahead and start with you, Charlotte.
Thank you. I think that gender movements have this ability to really help us understand the link between health equity and all of the other factors of women's lives that they're addressing. And you mentioned, women in agriculture, which is an area that we've been funding. And what we found there is that, we have made, exactly like so many of the panelists have talked about, we have made grants directly to women in communities who are members of cooperative farming groups, and given them grants to decide for themselves what is the best use of that grant money. And so it could be, in some cases, women have built collection centers that have been able to, allow them to not have to walk as far to deliver their crop to a common area. Sometimes it's been to invest in childcare center, and other times it's been to invest in vaccinations. So really, using as a funder, getting the money to the people who can make those decisions for their health in their communities, and use the money that way, I think is how I think women's movements really can have a tremendous impact.
Yeah, but I think the critical thing there is in making as direct investments as possible, and not prescribing the nature of the investment. Like, I actually think decolonizing is a really important way of thinking about this. I know not everybody thinks about it this way, but I try to, because I don't know this. So I don't know how to fix systems that interlock in a different way than the systems that I interact with every day. We have seen that when there is investment in the places where grassroots change meets system strengthening, we have seen that it works, and it works, and it works, and it's just a hugely underfunded sector of philanthropy, I think, or investment. And so for me, that's the critical thing.
And I agree with you 100%. I think that's the most important piece of this, is to get money and resources into the communities and get out of the way. It's to have that trust that those resources will be used effectively, and by the people in the community.
So we'll have more time for Q&A later, but I do want to get to Her Excellency Toyin Saraki. So I'd like to ask you, why are women's movements critical to health and health systems?
I think women's movements are absolutely critical, because women's movements also have the gender lens, and we know in detail what women need. We know that women are the most vulnerable, and that in any health system that's not strong, what you discover is that the women suffer first. Women are majority of the health workforce, 70% of us, but we're conspicuously underrepresented in senior decision-making roles. Now, just an example of it, recently in Nigeria, we were all in uproar over a young girl, Uwa, who was attacked, a statutory rape case, and she actually died. Now, the women's movements in the country pulled together, and we were able to move a major policy change that sexual assault referral centers should actually be at hospitals and not police stations. So when a women's movement takes their lens and their action to an old problem, what you discover is that the solutions that we bring are solutions that will work for women and girls, and ultimately for the entire nations. I think it's absolutely important that women's movements step up to the plate, are not waiting for permission, and actually engage in thought leadership as well as frontline action to ensure that the policies and the laws and the programs and the implementation are fit for purpose for women at any age. I've always advocated for women to be put first in health systems, so that we make sure that even right from the point of birth, a woman has an equal chance to succeed. And bringing, the voice of the youth into this removes the barrier that of gender equality, health, and well-being, to be sure that we're intentionally and deliberately making the decisions that are going to make women into leaders and make them into very good leaders. And workplace policies are part of that as well. A safe, respectful working place where female health workforce can be protected from sexual harassment, have her complaints addressed, and also have an equal pay is actually the way forward for the health sector and for most nations.
Wonderful. Thank you. Thank you very much for that. And so now we'll go to Tikhala. And so, you know, as the chairperson of a women's movement in health, you know, why are women's movements important to health systems?
Yeah, you know, quickly on that, and I also just want to touch on what everyone else has shared. You know, the past few months I've been working on research of just also understanding the unintended consequences around some of the funding streams and how we're doing funding. Reason I'm mentioning this, and especially even the time of COVID, you know, a lot of funders are very quick to fund different movements or different grassroots organizations around issues of gender. But we also need to see that on reality on the ground is we're also dealing with gender and social norms that we still haven't addressed. And sometimes the more we keep funding women-led organization in a very gender intentional way, we're also bringing in harm of unintended gender-based violence consequences. And there's been a lot of research and data coming out, and just sometimes there needs to be a thought process on the way we also look at issues of women and girls and issues of health as well. And I think we really need to also start questioning areas of bringing in gender transformative approaches, because we are still dealing with gender and social norms that we have not till today been able to address. The second thing I also wanted to say is that, you know, the health sector is very complex. It's not a one-sided agenda. There is different streams and levels of sectors we need to be looking at. Is it whether the health workers, and we have already heard that, you know, health workers, especially women in that area, work long hours, underpaid. We also know that, you know, issues of just health infrastructure and health facilities are not even conducive. I think there are a lot of areas that we need to be looking at. And sometimes when we are funding women's movement, we really need to be bringing everyone on the table in their respective sectors and levels to be able to engage in this conversation, so that if we are going to be looking into gender responsive budgetary models or approaches, then we need to ensure that everyone is on the table, inclusive and including all of those women organizations. An example of the SheDecides movement is that we have made it a political movement to bring in the policymakers, to bring in different movements also led by men, to bring in youth and young people on that table, and people work in the health sector, academia, and I think those are lessons we should be learning. And just another example of even the global partnership of maternal, newborn, and child health. I think just the level of the way they bring different constituencies around the table to discuss these issues and really kind of design this agenda in a level that brings in the different sectors, also a critical way we should be looking at these issues as well.
That's great. Absolutely. You know, I think it's really important to you know, look at the way that organizations operate. So you know, we mentioned at the beginning that, you know, only 1% of all gender-focused aid goes to women's organizations, right? So the bulk of this money actually goes to international organizations that are based in donor countries, rather than feminist groups leading on their own and leading context-specific solutions. So, you know, my question to all of you is, what can we do to change this? How can we ensure that funding actually goes to the place that it's supposed to go to, you know, and that it actually reaches those who it's meant to reach, right? You know, what are some of the ways that we can change this? Because it seems like there's been you know, quite a lot of dialogue, but what are those concrete actions? And
Can I jump in?
Leila, please.
Yeah, thanks. So just a couple, I think, from our experience. I mean, one is to ensure that we are working in multiple languages, and that may seem obvious to people, but it's amazing how many donors actually work. And, you know, the philanthropic community, it's mainly the US and Europe. So we work in 5 languages at the Global Fund for Women: English, French, Spanish, Russian, and Arabic. So you can apply for proposals in any language. I think removing onerous requirements, donors tend to have very onerous proposal requirements, reporting requirements. I think making those as community-centered and onerous-free as possible is really critical to diversifying who gets the funds. As Global Fund for Women, we're also part of a network of 43 women's funds that work at the global, regional, and national level. And the funds at the national and regional levels come often from the movements they serve. They're very connected to understanding what's happening in a local context. Where are the realities? What's changing? Where are there opportunities? And I think understanding local contexts and realities and being grounded in the communities we serve is such a critical part of that process. And then I think finally, thinking about our metrics differently. Donors come up with these crazy, very complicated log frames and outcomes and outputs. And when you really think about what is meaningful social change led by and for the communities who are most impacted by the harms of our world, and decolonizing, as you said, John, really thinking about how we shift back resources to the countries that they were extracted from in the first place, I think is a really critical way of thinking. And so even when we think about the language of aid and development, it's very top down, as if we're helping other countries when often those resources, and I come from Algeria, a formerly colonized nation, they were extracted from our countries. So I think that the way of thinking about reparations and decolonizing health and philanthropy is really critical to this conversation.
Really great. So next, I'd actually like to ask Her Excellency Toyin Saraki to jump in. So how can we ensure that funding goes to the people that it's meant to go to?
Well, the first thing is that we have to decide that we are actually funding the work of feminist movements to realize SDG 5, which is gender equality and empower all women and girls. When grassroots feminist groups lack funding, locally driven change run by women and girls will not be achieved. It also means we have to address the barriers of discrimination, gender-based violence, promoting the access to economic opportunity. And we have to make sure that at the entry level, as Leila said, people have a chance to apply for funding. On the other side of it is to make sure that while we are creating that the work of feminist groups contributes significantly, we also have to build that capacity for them to be able to account for that funding when they are bridging the gender gap. And I think that feminist activism contributes to policy change. We need to invest in the promise of technology and data collection to track the funding to women's rights organizations, and also open up the funding platforms and mechanisms to reach the last mile. The one thing technology will do is to reach the last mile for those who need it to apply. I think this will lead to better monitoring and how much of the funding actually goes to feminist groups. I think we all have to constantly call for change. We must exert pressure, and we call for change so that the funding actually trickles down to the front line in a way that is meaningful for them. I can't tell you how many times I will analyze a program that looks good on paper in London or New York, but I know would need extra components to actually work at the front line just because of the culture there or the way it operates. We need to build alliances between feminist groups. The Wellbeing Foundation supports the African Women's Leadership Network. We are about to start supporting women in global health, Nigeria, because we believe that it will provide an opportunity for learning and for building a collective voice to challenge these funding patterns. I think flexible long-term project funding for feminist movements has to be created, not just knee-jerk responses to certain particular challenges that appear. Disruption to funding always slows down the progress of advancing gender equality. And then I hope that feminist groups will set their own agenda and actually advocate for less administrative requirements for funding applications. Don't ask for too many documents that some of these younger groups that are doing great work at the front line simply actually have never encountered, so they cannot satisfy. That's what we need to really put equality, equity, and access into the system for women's groups.
Wonderful, wonderful. Thank you so much. And Charlotte, I'll actually go to you now with this same question. So, as a philanthropist, what do you feel is wrong with the system, and how would you change the system to ensure that we actually get more funding in the hands of women, women locally in country. You know, what are your thoughts about this?
Well, I think I'm not sure I can add a whole bunch more to what's been said. I mean, I feel like Her Excellency certainly covered the majority of you know, both the things that we need to be doing better and the things that we're doing incorrectly. I think, you know, certainly working collaboratively, having trust as philanthropists and not requiring tons of documents, and working collectively and collaboratively across, you know, organizations that maybe are working towards women's movements, but also across different sectors, whether it's agriculture, health, economics. So really trying to focus on working together and being collaborative. That's what I would add, I guess.
Wonderful, great. Tikhala, on what would you like to take a question? We're getting quite a few questions in the Q&A, so I'm going to actually ask both of you if either of you want to take this question, to please keep it brief.
I think this is a place where I should be listening more than talking, so I'll turn it over to Tikhala.
And that's sometimes a great skill in allyship. Thanks, John.
Yeah, quick one. So you also have time, because I really want to have time to actually get people's comments and questions coming in as well. But I think for me is to also say, you know, if we are talking about decolonization, we really need to start thinking of the countries that we're also working with. How do we start looking at strengthening domestic resourcing? Because my worry is we continuously keep creating this cycle of donor dependency. And also the issue of sustained impact is also something that's being affected when we're not thinking of ways of funding that can strengthen domestic resources. So countries and governments can start taking leadership and ownership on these issues, because I really do feel like there's a huge disconnect globally, where globally there's political will on, you know, gender responsive agreements and commitments and so forth. But when you go to the local level, you know, a lot of local leadership and governance are not ready for that. And most of the time we see these funding coming in for like 1 year, 2 years, that are not really getting to the root of the issues, but also not even investing in the infrastructure for governance and political leadership at a country level to be able to sustain that impact, but also take ownership, right? And then the other key thing that I really wanted to mention on this is that I think when it comes to donors and really bringing in the lens of decolonization as well, is that we need to get away from this, oh, we're going to give a seed grant of 5,000 or 10,000. There is no way you're going to transform the gender issue, the infrastructure issues, the social gender norms with a seed grant for 10,000 or 20,000 at grassroots movements for a year. If you are worried about, you know, the capacity that grassroots organizations have, or, you know, the systems that they don't have, then invest in building those systems and that infrastructure, and looking to funding huge amounts of funding that actually gets to the root of the issues, and also ensures that there's also sustained impact, where the governments and the countries begin to now take on that leadership to begin to drive change, so that there isn't that dependency of continuously wanting more funding from donors. So I think those are the key things we need to start looking at, and having more kind of, you know, equal partnership in terms of where the funding's coming from, and also the leadership on the ground.
Wonderful. Thank you so much, Tikhala. And I see actually one of our Women in Global Health Malawi members commenting. We actually have a chapter in Malawi, so maybe maybe you guys can link up. That's really great points. And I think you know, it's just such great insight that you know, we oftentimes go in with a lot of big prescriptive ideas, but yet we, you know, find that we have to take 10 steps back, you know, to even begin to make the changes that we want to see. So thank you so much for that. So I want to just get to the Q&A. We have 7 questions in the Q&A. And one of the ones that I thought was really interesting is by Christine, and she's asking, do you feel that gender-specific initiatives that have more Western concepts and are not realistic to the cultural norms of the country are implemented with the realistic and honest feedback from the grassroots organizations? Should some of these take baby steps to push the movement forward rather than pushing high targets for programs and projects that are unsustainable once the funding has gone? And I think Tikhala had already started speaking to this. But are there any others who might want to take on this question?
I'll take it. Well, firstly, what I would like to say is the first thing we have to do is remove this idea of north-south being high-low. What I've discovered, especially working with young people, is that the digital economy has actually pretty much removed that whole donor recipient attitude when it comes to program implementation. If you have a global partner who has a particular aim and they come to you as a local organization, this is the aim we want. It is your duty to tell that global partner that this is the situation on the ground. This is what our own people on the ground want. You know, we're talking about equal relationships now. You know, if a donor wants to do some work in Africa, by the way, you need Africa to be able to do that work. And we should be able to shape that work to the needs and aspirations of our own people. So I have never once taken a grant and just said, okay, I'm just going to swallow it like that. I sit down, I go through it line by line. I look at the target community. I ask them what they want, and then we shape it to fit. And to be honest, we have to reach that stage that if it does not suit our community, irrespective of how much is offered, you must reject it. The next time they come round, it will be shaped to suit the community. And I think this is a very important thing for those of us who are on the receiving end to be able to begin to shape. That is actually the way to true development, that we actually get these programs that will actually suit our people, achieve what we want to achieve, and go to scale. That's just my opinion on that one.
Great, thank you. Would anyone else like to take that question? And I'll have one other, and then we'll move on to the next question. Okay, all right, so we'll move on. We have a lot of questions in the pipeline. So this one is actually for John Green. So this is from Chanel, and she says, Mr. Green mentioned starting from a place of listening. And she says, I wondered at what point is appropriate to move from simply listening to listening and engagement?
Yeah, well, I think listening is an engaged process. And so for me, listening is not just about like reading books. It's about trying to have conversations with people that, you know, trying to be in places insofar as possible. It also means listening to people on the internet, which is an engaged kind of listening, at least at its best. For me, the question is like, when does listening move to action? Because you can listen, you know, you can listen forever and worry about unintended consequences and worried about bad downstream effects. And I think that's very important. And I think it's important to stay conscious of that throughout your life, not just when it comes to where you allocate resources, but also when it comes to like how you spend, you know, resources in the rest of your life. But you know, to me, it's about being moved to action, and we're moved. You know, we don't really have a resource problem, to be frank, in my opinion. Like, we do have limited resources on Earth, of course, but like the problem is not the limitation of resources. The problem is that we have an empathy problem, and we have a problem with a lack of shared collective will. We have a problem with not, you know, not looking or taking seriously the suffering of people whose lives may feel distant or different from ours, and that, I guess, is the part where you have to stop only listening and begin having, you know, your philanthropy include giving your time, giving your resources, and really, like, I think giving back your time and resources is a better way of constructing it than giving away. So yeah, I think that's when it's time to start giving back.
Wonderful, great, thank you so much, John. There's a really interesting question that I also have about, do the panels have insight on how to tackle social and cultural stigmas surrounding women's health? So I know Tikhala had started alluding to some of those social norms that, we don't acknowledge oftentimes, and especially in the donor community, we sort of don't meet people where they are, right? And we sort of assume, or we, prescribe, right? So I'd like to ask a question on, from any of your perspectives, how can we tackle these norms, within the context of women's movements? And examples are always great.
I think I can just briefly come in. Some of the work that I've been involved in and research that I'm working on as well is that there's really a need for us to start dealing and looking at things in a gender transformative approach. And I did mention this earlier, because what I'm seeing is, yes, it is very, very important to support women's movement, but if we are not bringing the men to the table and to these conversations, to these dialogues, issues of social norms and gender norms and culture norms are always kind of left aside. We are seeing a lot of donor-funded interventions that would specifically want to fund, women-led. It should only look at, your intervention should only look at women and girls, and that's it. And those are the type of, conditions that also bring harm and barriers and hindrances to actually bring in that gender transformative approach, where my intervention needs to bring in these traditional leaders, needs to bring in these religious leaders, needs to bring in these men and the women and the girls, and we need to be able to have this dialogue to be able to address these issues. And I think secondly as well is that there isn't much data on this. And, I spent this past months just literally digging into data in terms of, what is working, what's not working. I think there's been a lot of, drops of interventions in different places, but I really think we need to really invest long-term and a lot of funding towards this that can really look into testing different models on what works in addressing social, gender and culture norms. And like I said, if we are going to do funding and addressing and testing models around this area, let's also bring it in a way that we're building infrastructure so that the countries in turn can also take ownership and acknowledge these issues, especially when we're dealing with patriarchy systems in most of these countries.
Great. And I see Leila. Yes.
Yeah, we're in such a dire situation in the world today that I also think sometimes it's difficult to not embrace also some of the successes. And I do think that we've been reviewing the Beijing, 25 years after Beijing, and there are changes that have been made. We do think about gender-based violence differently. We do think about early forced and child marriage differently. We do think about female genital mutilation and cutting differently, comprehensive adolescent sexuality. So I do think there's been some of those norm shifts. And if we look at where those norms, and I see there's also, I know it's challenging and it's not linear, but I do think we need to also acknowledge where there have been shifts. And a lot of that has been around investing in the community's most effective mobilization at the local level, champions at the local level, and engaging in that social norm change, the advocacy work, and working, at different levels of change. So I think it's important just, especially now, given how challenging our world is, to recognize that.
Great.
Yeah, sorry, I just wanted to just add on and say, my point wasn't to say there's no data at all showing what's working, what's not. There is data, but I think the issue is that it hasn't been sustained. Do you know what I mean? Especially, I think, with the COVID pandemic coming up,
Yes, I agree.
all the issues and interventions that we've had that have actually looked at addressing these issues, they're all coming back. We're still seeing a high rise of child marriage now, especially with the pandemic, teenage pregnancy, and all these issues. So for me, it's really
Absolutely.
to say, how can we invest in, interventions that we will ensure that there's sustained impact and that we won't kind of have this coming back all over again, because at the end of the day, we are not really looking at the root issues and the systematic issues around this and the crucial mind change shift that really needs to be happening.
Mm-hmm. Great. Wonderful. Well, we only have a couple of more minutes left. I know we got started a few minutes late, but want to make sure we get in this last sort of round robin question, which is, what is one action or change that you'd like to see take place in building back better for more equal and more gender equal global health? And so I'll actually start with you, Charlotte.
I think that I would call on fellow funders to really take to heart what has been discussed here today, and to make holistic structural investments over a long period of time, and not put so many restrictions on grants and not create extra work where it doesn't need to happen. I mean, I think, getting money to the people in communities that need the money, and invest in long-term systematic structural investments, I think is what I would ask funders to do.
Great, thank you so much. John.
I mean, if I could see one change immediately, it would be to pay all women healthcare workers fairly for their work, and to invest in training and proper protective equipment and everything else that that the people who are actually doing healthcare work, from birth attendants to midwives to nurses, deserve.
Wonderful, John. And when we were doing our briefing, I actually told you that I couldn't have planned it any better for you to mention the Women in Global Health ask number 3. So that's so great. Thank you, John. And Her Excellency, Toyin Saraki.
Well, I would really like to see comprehensive community health go right to the front line. I believe that health that is within people's communities delivers a lot more than health. It delivers education, it delivers nutrition, it delivers immunization, it delivers jobs for the locals. And I would like to see that come in at an equal pay grade for women and men. I actually really believe that what we do at the very front line of the community is what is going to bring the leaders that we say we want in great quantities, not just the curated few. So I'd like to see increased community action.
Wonderful, thank you so much. And I'm going to go to Leila, and then I'll give Tikhala the last word.
I'll just say to give back resources and to do that in flexible ways, long-term ways that address systemic change.
Excellent, thank you so much. Short and to the point. Tikhala.
I think for me, it's simply, if we are going to be talking about gender equality, then gender equality means equality in the discussion on what gets funded and what and how. And I think remove the restrictions, as Her Excellency Saraki said, this is we need to start looking at things holistically. And when we are looking at things comprehensively and holistically, you can't put restrictions to that. And we are dealing with people's lives, vulnerable populations that are so affected by this. And these will need for us to really put that human-centered approach and start thinking comprehensively and start removing the restrictions that are there that are hindering progress.
Great, thank you so much. Well, this has been such an enlightening panel. I know that there were probably many more questions that we didn't get to, but I do encourage everyone to stay engaged with Women in Global Health, and also with our COVID 5050 campaign, which is covid5050.org. We actually had 40 pledges and commitments, actually a little bit over 40, I think it was 42, from organizations in global health, multilaterals, and governments who have committed to one or more of our 5 asks, and are reaffirming SDG 5 in the context of COVID-19. So we're thrilled that this campaign is continuing to build momentum, and our Ask 5 is around funding women's movements. So we really hope that you'll stay engaged with us, that you'll join a Women in Global Health chapter, and that you'll continue to do the great work that you're each doing in your lives and in your profession. So thank you so much to everyone for joining. Thank you sincerely to our wonderful panelists. and wish everyone a good evening, good morning, and good afternoon, depending on where you are. So thank you.
Thank you very much, Sarah.
Thank you,
you.
everyone.
Thank you, Sarah.
Thanks, everyone.
Thank you, Sarah.
Bye, everyone.
Everyone.
Bye-bye.